Hey there. If you've ever tried rolling out a new piece of technology, a solution, even a smart device or something like that in a clinic or a healthcare organization, and you've faced pushback from the team, you're not alone. In fact, getting buy-in from, we're going to call them clinicians, from administrative staff, from the team members that are delivering care, is one of the biggest reasons why digital health initiatives fail in most healthcare organizations, whether that be a provider agency, a private clinic, a hospital system, or a hospital department. A lot of times, the reason this new piece of software or this new tool that's supposed to save us money or provide some kind of benefit fails to achieve those results, a lot of times it's because of the failure of the lack of buy-in from the team members, right? The team that's going to be using the new tool or new software. I get it. I mean, you've done the research probably. You've found what looks like the perfect, maybe it's a telehealth platform, remote therapeutic monitoring, or remote patient monitoring platform, or even, God forbid, an EHR, an electronic health record, if you're going to shift those around. I know that doesn't happen all that often in big hospital systems, but for private practices, even if it's, regional, mid-regional chains of providers, a private practice or something like that, an EHR change is a real possibility. And you might be excited about it. Maybe leadership's excited about it. But the team is not so much excited. I always joke, as a consultant and a practice owner myself, like, if you want to move the clock in the clinic from the right wall to the left wall, you're going to get, 10% of the team will be like, yeah, sure, whatever. And then you're going to get a whole bunch of feedback. It's like, why are we doing this? It's been over this way for so long. So, but the reality is this: if you don't get, or you fail to get buy-in from the team members, the best tech solution in the world won't deliver results for your organization. So I kind of mentioned it before. I own a healthcare practice here in Augusta, Georgia, where I'm located. But I've also been involved as a healthcare consultant, helping, they call it digital transformation, but helping healthcare systems, state health agencies, and the like incorporate technology, essentially. I did a lot of virtual service delivery, standard operating procedures, clinical guidelines, and operational guidelines for implementing telehealth and virtual service delivery, especially during the height of COVID, and it's kind of carried on through the last 4 or 5 years. I've worked with tons of organizations, large ones, small ones, like I said, health systems, government agencies, helping them implement technology that actually works, both for the team providing the care, but also for the patients receiving the care. Over the years, I've seen firsthand what separates a successful tech launch or tech rollout from like a total flop, right? And it comes down to one key thing, really, and that's, we call it internal stakeholder alignment, or getting the team on board, right? If the team doesn't want to use it, it's not going to happen. So I normally think about implementing technology in the clinical workflows of an organization or operational workflows of an organization. I think about 3 main things prior to the rollout, right? The first step is getting the team involved early on. Don't just drop a new system on them on a Monday and expect that it's going to go all right. This is pretty common knowledge, pretty common sense, I think. But you want to involve the team from the beginning. When you're considering this new piece of technology, bring in representatives from whatever group is going to be involved. Maybe it's the administrative or the clerical staff. Maybe it's the clinical staff. Get them all in a room together so that you can begin getting their perspectives about potential roadblocks or challenges or whatever before selecting even, or starting your selection process for a piece of software or technology. Ask them currently, like right now in your day-to-day, what's working, what's not, what would make your job easier. And when people feel heard kind of in that process, at least, they might be apprehensive to change or implementing something new, but at least they feel like their viewpoint was taken into consideration when the decision was being made, and they feel like they have some ownership over that implementation because they've had input into the reasons why we're doing it, right? Which brings me to point number 2 in this whole thing is you want to make sure that you're connecting whatever transition is maybe it's a new, like I said, a new EHR and maybe a telehealth platform or something like that. You want to connect that move or that implementation to the larger why or purpose of the organization, right? Your staff doesn't often care about shiny features. They care about how it helps them, treat their patients and how it helps the patients ultimately, especially clinical staff. They want to know that patients are going to, have better clinical outcomes or get treated better as a result of rolling out a new tool. So you've got to connect that new tech, the new platform, to the bigger mission of your organization. For example, we just went through a big EHR rollout at the clinic that I own. And, from the very beginning, what I ended up telling the team, we brought them on early, we did all that. But what I told the team at a big all hands meeting when we were talking about making the change and kind of what the change was going to be, I started by talking about why. Like, why are we here? We're here to help patients. I run a physical therapy practice. So it's, we're here to help patients overcome their pain and live a long, happy, active, and pain-free life. There are some limitations in our current infrastructure that's preventing us from doing that, right? I've heard the complaints. I know that this EHR fails to do this, or it's adding a barrier here, or you're spending too much time on XYZ. What we want to do is we want to make it easier for patients to access us, for you to document, for you to spend more time with your patients, whatever the case may be. It's going to free you up so you can treat the way you want to treat, and that fits in our larger mission as an organization, the purpose for us being here. So when you tie it all into the grander mission, vision, the higher purpose of the organization, your team sees how it fits into the broader goal of the organization, and you're giving them understanding that it's not we're not pulling this out to save money or to make their life more difficult or whatever. Like there's a thoughtful reason why we're selecting or we're considering implementing a new piece of technology in this piece of the process of care, or in this, in this administrative queue over here, or the clinical workflow, whatever it is. They understand why the decision is being made. And sometimes that's enough to get a large majority of your team on board, because then they understand, okay, we're not just getting this new system foisted on us. We understand the reason why. We've been talked to about it. We've had some input in the decision, and we understand that ultimately it's going to help patients, receive better care at our organization, right? And then step 3 is during the prior to the rollout, during the rollout, and after the rollout, you want to provide a ton of training, ongoing support, troubleshooting. Even the best tool, the most user-friendly technology, the most user-friendly platform, it can be overwhelming at first, especially if for clinicians who are used to, this is how I start my day. I log into this system. The patients come in, I start doing X, Y, Z, and working through my normal routine. You're upending that. No matter which way you slice it, you're upending part of their workflow, and that can be overwhelming. So what you need to do is leading up to it and during that transition and even immediately afterwards, you want to offer clear, simple training, and then ongoing support. Like, let's have a check-in. Let's see what's working, what's not working. You can create champions in the organization. Maybe you're going to have a clinic lead or a clinician who's going to spearhead the rollout and the training, and they become an expert on this new platform, and that can be a resource for their team members as the rollout is occurring. Call them super users, if you would, who will help answer questions for your team and build that momentum as you begin implementing the tool. Remember, adoption is not something easy, and it doesn't happen overnight, but if you support the team as they learn and they adapt, they're going to get excited about the possibility, because they'll see the benefits. They'll see the outcome of it if they're using it to the effect that you envisioned, and hopefully receiving and seeing those outcomes that were talked about before the decision was made, right? When you first brought up, we're thinking about swapping out the software or implementing a new piece of technology or whatever. Ultimately, at the end of the day, I say this all the time, healthcare is a human ordeal. It's a human connection. It's all about people. Oftentimes we think about it as healthcare providers as the people receiving care, right? The patient. It's all about the patient, and those are the people that we really want to focus on. But at the same time, it's a two-sided equation, right? The people receiving care, but then also the people that are delivering that care, and getting your people, the people that are going to be delivering the care to your patients, aligned is the key to making any kind of new tech rollout work for everyone involved. If you want patients to have a positive experience, the clinicians themselves need to have a positive experience, or the treatment team needs to have a positive experience. So anyways, hopefully you found this video helpful. If you want to learn more about digital health transformations in healthcare and the like, I'll leave a link down below. You can check that out. Otherwise, check out the podcast, betteroutcomes.show. Check it out on YouTube here. Be safe, be healthy. I'll talk to you then.